Welcome to this informative video about polar cataracts, a specific type of cataract that affects a particular region of the lens in the eye. We'll explore what polar cataracts are, what causes them, how they're diagnosed, and what treatment options are available. Understanding this condition is crucial for maintaining optimal eye health. Polar cataracts, both anterior and posterior, can arise from a variety of factors. In many cases, they are congenital, meaning a baby is born with them. This can be due to genetic mutations passed down from parents. They can also be related to other underlying congenital conditions or syndromes. Other potential causes include trauma to the eye, certain medications such as corticosteroids, or metabolic disorders. However, in some instances, the cause remains unknown, which we refer to as idiopathic. To understand polar cataracts, let's quickly review the eye's structure. The lens, located behind the iris, is responsible for focusing light onto the retina. In a polar cataract, the opacity, or clouding, develops specifically at one of the poles of the lens, either the anterior pole, on the front surface, or the posterior pole on the back surface. Anterior polar cataracts are often located directly beneath the anterior lens capsule and may involve the capsule itself. Posterior polar cataracts, on the other hand, are found beneath the posterior lens capsule and can have a saucer-like or cup-shaped appearance. These opacities disrupt the normal transmission of light through the lens, leading to visual disturbances. Estimating the exact prevalence of polar cataracts is difficult, as many small or asymptomatic cases may go undiagnosed. They are more frequently observed in children due to their congenital nature. However, they can also be found in adults, particularly in association with risk factors like trauma or medication use. Congenital cataracts, as a whole, occur in approximately 1 to 6 per 10,000 live births, and polar cataracts make up a portion of this number. The signs and symptoms of polar cataracts can vary greatly depending on the size, density, and location of the opacity. Small, mild polar cataracts may not cause any noticeable visual problems. Larger or denser cataracts can lead to blurred vision, glare or halos around lights, decreased contrast sensitivity, and difficulty seeing in bright light, especially for posterior polar cataracts. In children, a polar cataract may be detected during a routine eye exam or because of abnormal eye movements like nystagmus or a white reflex in the pupil. Diagnosis of a polar cataract typically involves a comprehensive eye examination by an ophthalmologist. This includes assessing visual acuity, checking the refractive error, and examining the lens using a slit lamp, a special microscope with a bright light. The slit lamp allows the doctor to visualize the anterior and posterior segments of the eye in detail, identifying the location, size, and density of the cataract. In children, dilated fundus examination may be necessary. Photography and other imaging techniques can document and monitor progression over time. Polar cataracts are broadly classified as either anterior polar cataracts, located on the front surface of the lens, or posterior polar cataracts found on the back surface. Within these categories, there can be variations in size, shape, density, and involvement of the lens capsule. Some polar cataracts are visually significant while others are not. Additional classifications depend on if it has any specific morphological features like anterior persistent pupillary membrane. The treatment and management of polar cataracts depend on the severity of the visual impairment. Small, non-visually significant cataracts may only require monitoring with regular eye exams. If the cataract is causing significant vision problems that interfere with daily activities, surgery may be recommended. The most common surgical procedure is phocoemulsification, where the cloudy lens is removed and replaced with a clear artificial lens, or intraocular lens IO. In children, especially infants, cataract surgery requires careful consideration of the child's visual development. Sometimes an IO may not be implanted immediately, and the child may need to wear contact lenses or glasses after surgery. While it's not always possible to prevent polar cataracts, especially those that are congenital, there are steps you can take to minimize your risk. Prenatal care and genetic counseling may identify risk factors for congenital cataracts. Avoidance of certain medications, like corticosteroids, unless medically necessary, can also help. Protecting your eyes from trauma with appropriate eye protection is crucial. Regular eye exams are essential for early detection and management of any eye condition, including cataracts. The prognosis for individuals with polar cataracts is generally good, especially with timely diagnosis and treatment. Surgical removal of the cataract can restore clear vision in most cases. The visual outcome depends on several factors, including the presence of other underlying eye conditions and any complications that may arise during or after surgery. Ongoing research continues to refine surgical techniques and improve the design of intraocular lenses. Gene therapy shows the most potential in congenital cataracts. Advances in pediatric ophthalmology are also improving visual outcomes for children with congenital cataracts.